Hi, I'm Winnie and this is my research proposal. Dengue is a viral infection carried by the Aedes aegypti mosquito, which thrives in subtropical and tropical regions around the world. The incidence of the vector-borne dengue fever, or dengue hemorrhagic fever, has increased by 30 times for the past 50 years according to the World Health Organization, or WHO. The WHO recognizes the causes of the worsening dengue problem, which are urbanization and a link to human behavior. There exists poor quality housing, water supply shortage, waste and sewage systems issues, environmental practices, and human migration, which result to a favorable habitat for the dengue carrier mosquito. The same WHO report also notes that from 2004 to 2010, dengue, a global health problem, prevails in the Philippines, which ranks 7th among 30 most highly endemic countries, with 54,639 dengue cases. The latest figures of the Department of Health Epidemiology Bureau further shows that there were 92,807 dengue cases nationwide in the Philippines from January to September 2015, which is 23.5% higher than 75,117 cases covering the same period in 2014. The Department of Health, or DOH, for its part, launched the Dengue Prevention Control Program in 1993, and to date, the Aksyon Barangay Contra Dengue, or ABACADA nationwide program is continuously being conducted to prevent the spread of the disease. The important aspect of the ABACADA program educates the communities and elementary school students on the practice of 4S, which are search and destroy, self-protection measures, seek early consultation, and say no to indiscriminate fogging. Despite this program, there is still a 156% surge of cases in 2015 compared to 2014 in Metro Manila alone. One possible cause of this problem, other than the virulence of dengue and urbanization, can be communication in nature. Elementary students are among the high-risk groups. The WHO estimates that about 22,000 deaths occur annually worldwide, mostly among children. Children are susceptible to dengue due to low immunity, which is physiological in nature. However, a controlled factor to break the spread of dengue is informing children about dengue and its prevention measures. The Sustainable Development Goals, or SDGs, of the United Nations includes dengue prevention under SDG number 3. Ensure healthy lives and promote well-being for all at all ages. By 2030, end epidemics and neglected tropical diseases among many. One of the solutions to dengue, a neglected tropical disease, is instituting preventive measures, such as the Global Strategy for Dengue Prevention and Control 2012 to 2020 of the WHO. Two of the three goals in this strategy are to reduce dengue mortality by at least 50% and morbidity by at least 25% by 2020. Integrated in this strategy is one of the enabling factors for effective implementation, which is communication. Communication may be strengthened to achieve positive behavioral outcome by crafting appropriate messages and disseminating this through various media channels. At present, I have not found any related literature on the knowledge of and practices on dengue prevention among private or public elementary school students in the Philippines who are part of the vulnerable groups. Moreover, I have not seen any studies on preferred communication media or sources of information as support to behavior change in the particular age group and location. Research question: what are the knowledge of and practices on dengue prevention and preferred communication media among elementary school students that serve as a foundation in developing an alternative communication medium learning tool? Objectives. Number 1. Assess the level of knowledge of dengue prevention among students in one of the most populous public elementary schools in Manila District in terms of the following: causes, signs and symptoms, modes of transmission, and prevention practices. Number 2. Describe the students' practices on dengue prevention in terms of the following: search and destroy, self-protection measures, seek early consultation, and understanding of indiscriminate fogging. Number 3, examine the communication media preferences of elementary school students in comparison to other traditional communication media in obtaining dengue prevention information. And number 4, draw implications from the gaps in the knowledge, prevention practices, and communication media preferences of the target population for the development of an alternative communication medium learning tool on dengue prevention. Literature review. Determining the target population's knowledge of and practices on dengue prevention serves as data in crafting these messages and packaging them based on the target audience's profile. There have been studies conducted from several countries showing a positive association between knowledge and actual practices on dengue prevention or eradication. There are many. One of them is Murugan Subramaniam's study on primary school children of SK Kotamasai, Johor, also showed an interrelation between knowledge about dengue fever, breeding places, and method of control. However, there are also studies conducted in the Philippines reporting otherwise. One of them is Kwan and Crizaldo's study among the Ruenas community also revealed that no significant association exists between knowledge and attitudes and practice level. Regardless of conflicting findings from previous studies, common recommendations include the conduct of awareness campaigns or information, education, and communication programs in target communities, and incorporation of a dengue prevention module in the school curriculum. 4 studies in relation to the latter recommendation presented positive results. First, Lennon and Coombs' pre-test, post-test experimental study on the use of board game about dengue showed significant increase in self-efficacy even without teachers among primary and secondary school students in the Philippines. Second, Vesca, Gomez, and Casares Manrique concluded in their study that play-based education was effective in improving knowledge and practice regarding dengue prevention among primary school children in Bucaramanga, Colombia. Third, Hoothmaker's study revealed increased knowledge, attitude, and practice scores about dengue among primary school children in Florida through the use of animation entitled Dengue Fever Comes to Town. And fourth, Solidum and Solidum's study showed that storytelling about dengue as a teaching method was effective, fun, interactive, and improved memory recall among preschool and elementary students in the Philippines. In doing so, this study focuses on alternative or non-traditional teaching methods such as entertainment education concept. The Centers for Disease Control and Prevention in the United States of America also advocates for entertainment education as a means of health communication, which includes the topic of dengue. Entertainment education concept stems from the diffusion of innovations theory by Everett M. Rogers. Rogers and Arvid Singhal in 2004 defined entertainment education as a process of purposely designing and implementing a media message through a means in which the audience is both entertained and educated in order to increase audience members' knowledge about an educational issue, create favorable attitudes, and change overt behavior. Text, video, audio, and face-to-face comprises the general characteristics of communication media as identified in the media richness theory by Daft and Lengel. In this study, the elements of characteristics of the top 3 communication media preference of students will form as a basis in constructing an alternative communication medium as a learning tool in dengue prevention. Theoretical framework. Behavior Change Communication, or BCC, is the underlying framework of this study. Knowledge and practicing trial behavior change are stages of the behavior change continuum. One of the enabling factors in gaining knowledge and behavior change includes the provision of effective communication through various channels such as mass media, traditional media, community networks, and interpersonal or group communication. This study aims to identify the gaps in knowledge and practices and develop an appropriate communication medium on the premise that the target population prefers non-traditional teaching methods such as entertainment education. Entertainment education, as an example, becomes an effective means of disseminating information and sustaining behavior change on dengue prevention coursed through one channel, the teacher or the school. In January 2002, the Centers for Disease Control and Prevention developed the CD Synergy model as a health communication planning tool for health-related programs. The 6 phases in the CD Synergy model are problem definition and description, problem analysis, communication program planning and evaluation, program implementation and management, and feedback. In this study, CD Synergy model serves as a guide to accomplish the end goal of developing an alternative communication medium learning tool. This study states the first phase of problem definition and description in the rationale or background of the study. The second phase identifies the gaps or low levels in knowledge and practice and communication media preference through survey. This study ends at phase 3 on communication program planning by crafting the messages integrated in a communication medium based on the survey results. Conceptual framework. Identify the level of knowledge of dengue prevention and level of practices on dengue prevention. Find the gaps in knowledge and practices. Preferred communication media. Identify desirable elements. To sum up and create an alternative communication medium learning tool on dengue prevention. Methodology. Research design. This study uses survey research design, specifically cross-sectional survey, to be conducted from August to September 2016 among elementary students. The survey is interviewer administered with questions based on Abacada program of DOH. Other questions originated from studies of Ibao and Labrage, Schwab et al. With some revisions. Locale of the study. Manila has the most number of dengue cases in the National Capital Region from January to July 2014, according to the Department of Health. Respondents of the study. The target population of this study are elementary school students studying in Manila District. The school chosen for this study is H.J. Atienza Elementary School, Malate in Manila District, which ranks 9th as the most populous elementary school in the National Capital Region for the school year 2014 to 2015, with 8,489 enrollees based on the Department of Education. Sampling procedure. A minimum of 368 students serve as respondents with 95% confidence level and 5% margin of error. Respondents are selected based on simple random sampling. Data gathering procedure. I will request the distribution of the instrument from the principal of H.J. Atienza Elementary School in Manila District. Upon approval of the request, I will meet with the principal and registrar to obtain the names of the respondents who will be randomly picked from the list of enrolled students for the academic year 2016 to 2017. I will then organize the respondents into 3 groups and set 3 specific schedules with corresponding venues to administer the instrument. During the survey proper, I will read the statements one by one in English and translate it verbally in Filipino. The survey instruments will be collected on the spot. Data analysis. The instrument contains 3 parts. The first part has 15 questions covering dengue topics on causes, signs and symptoms, modes of transmission, and preventive practices, answerable by yes and no. Yes is given a numerical value of 1 point, while no is given 0 point. The higher the scores mean the higher the level of knowledge. Scores of 13 to 15 is interpreted as excellent knowledge, 10 to 12 as good knowledge, 7 to 9 as moderate knowledge, 4 to 6 as fair knowledge, and 0 to 3 as poor knowledge. The second part evaluates the practices on dengue prevention. There are 15 indicators measured by Likert 5-point scale as follows: 5 as always, 4 as usually, 3 as sometimes, 2 as seldom, and 0 as never. The higher the mean score shows a better practice on dengue prevention. The third part measures the frequency of the preferred communication media in comparison to other sources of information. The communication media are ranked based on the number of frequency. The higher the frequency means the greater the preference to a particular communication medium. A respondent can choose a maximum of 5 items. Gaps or low levels in the knowledge of and practices on dengue prevention and the communication elements culled from the top 3 preferred communication media serve as basis in developing the alternative communication medium learning tool.